I decided to do my project on E. coli, which is known as Escherichia coli. Escherichia coli, E. coli bacteria normally live in the intestines of people and animals. Most E. coli are harmless and actually are an important part of a healthy human intestinal tract. However, some E. coli are pathogenic, meaning that they can cause illness, either diarrhea or illness outside of the intestinal tract. The types of E. coli that can cause diarrhea can be transmitted through contaminated water or food, or through contact with animals or persons. I listed different types of E. coli. E. coli consists of a diverse group of bacteria. Pathogenic E. coli strains are categorized into pathotypes. 6 pathotypes are associated with diarrhea and collectively are referred to as diarrhegenic E. coli. I listed the 6 different pathotypes. There's Shiga toxin producing E. coli, which is known as STEC. That's the most commonly heard about in the news in association with foodborne outbreaks. Then you have ETEC, EPEC, EAEC, EIEC, and DAEC. I listed them in my report. Now the symptoms of E. coli. Symptoms of the Shiga toxin E. coli, which is the STEC infection, vary for each person, but often include severe stomach cramps, diarrhea, which can sometimes be bloody, vomiting. Some people may have fever, which usually is not very high. It's usually less than 101. Most people get better within 5 to 7 days. Some infections are very mild, but others are severe or even life-threatening. Most people with a STEC infection start feeling sick 3 to 4 days after eating or drinking something that contains the bacteria. However, illnesses can start anywhere from 1 to 10 days after exposure. So contact your healthcare provider if you have diarrhea that lasts for more than 3 days or diarrhea that is accompanied by a fever higher than 102. If you have bloody diarrhea or so much vomiting that you can't keep any liquids down and you pass very little urine. Now, to prevent yourself from getting this bacteria, there's many things that you can do to prevent yourself, which is practice proper hygiene, especially good hand washing. Wash your hands after and before, after using the bathroom or changing diapers. Wash your hands thoroughly before and after preparing and eating food. Wash your hands after contact with animals. Wash your hands before preparing or feeding bottles or foods to an infant or toddler if you may have any. Keep all objects that enter the infants' and toddlers' mouths, such as pacifiers and their teethers, clean. If soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol in it. The alcohol-based products can quickly reduce the number of germs on hands in some situations, but they are not a substitute for washing with soap and running water. Follow the 4 steps to food safety when you're preparing food. Clean, separate, cook, and chill. Wash fruits and vegetables well under running water. You need to cook your meats thoroughly. Don't cause cross-contamination in food preparation, meaning when you're cutting the meat and using the same knife or cutting board without washing it. Avoid raw milk, unpasteurized dairy products, and pasteurized juices. Don't swallow water when you're swimming in lakes, ponds, swimming pools, streams. Now, the symptoms of E. coli. Sorry, I already went over the symptoms now. For more information, of course, always contact your healthcare provider if you're feeling any of these different symptoms, and you can also visit Centers for Disease Control and Prevention. Thank you.